Resurgence of COVID-19 in parts of the South and West are causing some states to pause and in some cases partially reverse their economic reopenings. Maya Rodriguez is looking into if the potential for lockdowns could be on the table again for some.
The coronavirus grip on the summer of 2020 is shaping up to mean different things to different people. Dr. Caitlin Rivers is an epidemiologist with the Johns Hopkins Center for Health Security.
The picture does look different depending on where you are looking in the country.
Only 2 states, Connecticut and Rhode Island, recorded a drop in coronavirus cases last week. In a dozen other states, cases are steady, including hard-hit New York and New Jersey, which got their number of COVID-19 cases under control. But in the other 36 states, the number of coronavirus cases is on the rise, including record-breaking numbers in Florida, Texas, Arizona, and Nevada. But Dr. Rivers says, don't call it a second wave.
Most communities never left the first wave, and so it's difficult to call it a second wave.
But could a second wave of state lockdowns be on the horizon? Dr. Rivers says that would come down to a number of factors, the main one being hospital capacity.
Now, it's nobody's preference to reinstitute the lockdowns. They're enormously disruptive. They're costly, to say the least. It's a very difficult set of circumstances. So that's really for the worst case crisis situation. But we can't rule it out because we also cannot allow our healthcare systems to become overwhelmed.
That means keeping hospitals from reaching 90% capacity. Already, some states have paused their reopenings. In Arizona, Florida, and Texas, bars were ordered to shut down again because people were congregating without masks or social distancing, leading to virus outbreaks. But some medical experts warn more measures may be needed.
If we don't do something, and I mean really strong, on containment, surveillance, contact tracing, and isolation, we're in for a very, very rough time.
In the meantime, much of the protection against the virus may be left in the hands of each individual.
All of us, including those of us who live in states that are not experiencing a lot of transmission, should be spending a little bit more time at home, skipping mass gatherings, for example, wearing fabric face masks when going out into the community, and doing a really great job of hand hygiene.
In other words, not letting your guard down while the virus remains out and about. In Washington, D.C., I'm Maya Rodriguez.